Hello, everyone. Welcome to our webinar, All Students in School and Engaged. Many of you may be familiar with protocols for webinar participation, but let's quickly review. Everyone is on mute to eliminate all background noise. If you have a question or would like to make a comment, please use the chat function on the right of your screen, as this is the best way to communicate with us during the webinar. I also want to remind you that today's webinar is being recorded and it will be uploaded to the Chronic Absenteeism webpage. Thank you for your participation. This is our first webinar on chronic absence. We're pleased to have more than 150 individuals registered for this event, 50+ school districts, and a variety of community agencies that are key to supporting this work in their communities. We're also pleased to be presenting live at a breakout session at today's JRB List Conference at ITBD in New Britain, and I understand that there were over 90 participants who signed up for this breakout session. So if you're there, thank you very much for joining us. I am Charlene Russell Tucker. I'm the Chief Operating Officer for the Connecticut State Department of Education, and I'm pleased to be joined by two colleagues in the department. Marquel Middleton, who serves in our performance office and manages your student attendance reporting amongst other data collection, and also Kari Sullivan, who is in our Office of Student Support, who is our programmatic lead on attendance. So let's begin our presentation today. The work in chronic absence is anchored in the understanding that in order for all students to succeed, they need to be in school and engaged in learning every day. This notion is embedded in the State Board of Education 5-year comprehensive plan for education and also included in our next generation accountability system. At a recent press event on chronic absence to release our new chronic absence guide, Governor Malloy stated, and I quote, "Tackling chronic absenteeism is critical to improving outcomes for all of our students so that they receive an adequate education that prepares them to succeed in life," unquote. Addressing chronic absence is embraced at the highest levels of the Department of Education, and it is being addressed cross-functionally across our divisions. So on behalf of the Connecticut State Department of Education today, we recognize and applaud the progress that is being made and understand that there's still more work to be done. Today's webinar will debut our new guidance tool, Reducing Chronic Absence in Connecticut Schools, a prevention and intervention guide for schools and districts, and will address why attendance matters. We'll address some clarifying definitions, Connecticut's chronic absence landscape, understanding student attendance reporting, what districts and schools can do to improve attendance. We'll have time for questions and answers at the end and some closing remarks and next steps. So this is a picture of the guide. It was developed in response to Public Act 15225 that was codified in our Connecticut General Statute Section 10-198D, and it was developed with multiple stakeholders and in collaboration with Attendance Works. I must note that this public act also defines chronic absence so that that definition is in state law, and this law also requires districts and school attendance teams that we will address in later detail. So let's go into the question or the content of why attendance matters. Before we move into the why, we also have to talk about, well, what is this definition? So in current law, Connecticut chronic absence is defined as missing 10% or greater of the total number of days enrolled during the school year for any reason. It includes both excused, unexcused, out-of-school suspensions, and in the law as was earlier today, and in school suspensions that last more than 1/2 of the school day. And I note that because we were just informed that not too long ago, the governor signed a bill that will remove the half-day suspension from the definition. And so stay tuned because we will be sending information to further update you. Why chronic absence is an important issue is a question that is asked. National research documents the following negative impact, and they're on the screen for you. But at every age and at every stage, chronic absence erodes the academic and social skills needed to succeed in school. We know that children who are chronically absent in kindergarten and first grade are much less likely to read proficiently by the end of third grade. We also know that by ninth grade, attendance may be a better indicator of dropout than eighth grade test scores. To further solidify or making the case for addressing chronic absence, you're now seeing the slide that displays attendance in ninth grade and graduation in 4 years by meal eligibility in the 14-15 cohort. This graph illustrates the association between chronic absence in ninth grade and the likelihood of graduating on time in 12th grade 4 years later. It looks at two groups of students. The group on the left, those 3 bars are for students eligible for free meals, not reduced meals, but free meals, meaning that they're students coming from some of our lowest income families. This is the first set of 3 bars that you're looking at. On the right-hand side are students not eligible for free meals. Now let's look at each of the bars within the group. Each bar represents the attendance rate for that group. For example, the blue bar represents students who have satisfactory attendance in ninth grade. Satisfactory attendance means that chronic absence rate for those kids is not more than 5%, so they are in attendance 95% or better. These are students with good attendance in ninth grade. What we're seeing is that 4 years later, amongst those students who are from our lowest income families, 92.6% of them actually graduate in 4 years. Even among kids from our poorest families, if they have good attendance in ninth grade, they are graduating in 4 years at a rate that is even higher than our state average. So if they come to school, it matters. That is ninth grade to 4-year graduation for students eligible for free meals. Look at the other bar. This bar represents the students who are chronically absent in ninth grade, and only a little over 50% of them are graduating in 4 years. This demonstrates that amongst those students who are coming from our lowest income families, if they have good attendance in ninth grade, 90+% are graduating in 4 years. If they're chronically absent, just over 50% are graduating in 4 years. Attendance matters, and it makes a big difference. So let's move to a few clarifying definitions. In the section of the guide, what is chronic absence? We define chronic absence and truancy. And under how do we know if chronic absence is affecting learning, we address average daily attendance versus chronic absence. This slide places all 3 of them together just for easy reference. So average daily attendance, how many students show up at school every day, is what is addressed there. Under truancy, who is missing school without permission, it typically refers only to unexcused or unverified absences. And chronic absence, which I defined earlier, is missing so much school that students are academically at risk. And as we mentioned earlier, that definition is in state law and will soon be tweaked a little bit, as I noted before. This slide talks about or shows average daily attendance and the fact that average daily attendance, or ADA, rates can easily mask chronic absence. So you have the blue bars, which is the average daily attendance rate, the blue line, and the red line beneath, which are chronic absence. ADA is a school-level measure, not a student-level indicator that shows how many students were in school, not which specific students are at risk due to chronic poor attendance. It is problematic in the same way that an average third-grade reading score does not identify students who need additional intensive reading assistance. So this graph depicts 8 Alliance districts with network schools and visually demonstrate the masking effect that average daily attendance rates can have on chronic absence. hence the reason we are focused on chronic absence. Before we go into more details, let's just take a look at the chronic absence landscape in Connecticut. According to our Department of Education data, we know that 50,376 students are chronically absent from school during the 15-16 school year. This is just under 1 out of 10 of all students in Connecticut public schools. Chronic absence rates, you should know, are significantly higher in urban districts. Chronic absence rates for students eligible for free meals are more than 3 times that of those who are ineligible for lunch subsidies. And chronic absence rates for Black, African American, and Hispanic or Latino students are more than 2 times that of white students. And English learners and students with disabilities continue to exhibit substantially higher chronic absence rates when compared with their general education counterparts, which is what you're seeing about who is chronically absent. This slide really looks at and calls your attention to the fact that chronic absence rates are highest for our youngest and for our oldest students. Therefore, attention should be given to the early years and in transitioning to high school. So the question is, we know the data at the state level, and so the question for you is, do you know your numbers for your community? And so Kari will now show you or demonstrate getting that information from our very robust data portal, EdSite.
Thank you, Charlene. On this screen, you see a snapshot of the dashboard for our data portal EdSite. You can reach EdSite through our SDE homepage. It's on the left-hand side. There'll be a navigation button for EdSite. And I'm going to open that up now and show you that here it is live. And this website has all the information you'll want to know about any district, and it's at the school level as well. You have every month something new is added. You have an overview of how many districts, students, schools. But at this point, we want to show how to access your chronic absenteeism data so that you know how your school is doing or your district. So you go to the top of this screen and you click on students, and you'll see attendance and discipline. English learner data is all right there. And you click on attendance. There it goes. And it opens up to show you the state of Connecticut's 5-year trend for chronic absence, which Charlene just demonstrated for you in one of her slides just a minute ago. And I'm going to demonstrate, I spoke to the school district today. The school district of New Britain said it was okay for me to demonstrate their data because they've been doing a lot of work on chronic absence. So I'm going to select New Britain School District and then submit. So we'll see for the whole district what their chronic absence rates are. You'll see that they've been trending down nicely. There's a little blip in 2014-15. And then you can see all students, or you can see chronic absence data by different subgroup, which could help you target your strategies when you're trying to reduce chronic absence. And I'm going to pull up grade for the entire district. So you'll be able to see where we need to put our attention to reducing chronic absence. And you'll see, as Charlene showed you before, it's in kindergarten. Again, it's with our older students. It's the younger and the older students that we really need to start focusing on how do we bring down the absenteeism for those students. And just also to demonstrate, you can look at the data by school. So if we wanted to look at De Loretto School by grade, if I was a principal at De Loretto and I wanted to know which grade should I really be working on chronic absenteeism, I can pull up this table and see that, again, kindergarten, when there's an asterisk, it means the end is so small that the data is not included here for confidentiality reasons. So that is a quick overview of EdSite. I'm going to get Charlene back to her PowerPoint, and we will be addressing questions at the end.
So thank you, Kari. And before we transition to the next part of the presentation, I really just want to go back to the slide where we showed the numbers of students chronically absent over 4 years, really just to say that there is good news in the data. The number of chronically absent students in Connecticut dropped to 9.6%, down from 10.6% the year before, and down from a high of 11.5% in 12-13. And the decline in that rate means that over 10,000 more students are attending school on a daily basis than 4 years ago. So we are, as I stated before, we are making progress, and thank you for the job that you're doing out there. But we also know that there is no time to rest or take a break. As we can see, I keep this number close by, 50,376 students still need our support in order to improve our attendance. So now we're going to transition to the other part of our presentation.
I'd like to introduce Markwell Middleton from our performance office. He is here today to show you and demonstrate where the data comes from that is loaded on EdSite and how the data, the lifespan of the data, and how we get it here at the State Department of Education. And also, he's going to share with you a resource for tracking attendance and entering it in your PIS system.
So good afternoon, everyone. This illustration is what we call the data life cycle. This was created last year and just quickly illustrates the different phases that the data that districts and schools submit to us go through. Specifically this, we're going to talk about attendance. So in phase 1, we see it's called the day-to-day collection phase. So we like to think of that as what's happening daily in your districts or in your schools. So the children are coming in, they're in attendance, they're absent, that's what's going on there. And districts should be collecting that data accordingly in advance of our collections. On stage 2, we call it the data submission pre-planning phase, where districts are going and cleaning their data at the local level and getting it prepared to submit into a collection. So you'll see the bucket and the suds and the numbers, everything's getting clean. On stage 3, you'll see we're transferring data into a larger bucket. That's our initial data submission phase. So that is when the data is coming to us here at CSCE. Step 4 is what we're calling our data review. So once districts have uploaded their data, they are really to be reviewing their data and making sure that it's 100% accurate. In step 5, it's called the data certification phase. Stand by your data, you'll see that's listed there. The data for most of our collections administered by the state require that they are certified by your local superintendent. So each superintendent has a unique and secure code that they will certify that what you've submitted is correct. In step 6, it's the CSDE data review phase. So here, that's where I'm at my desk looking at the data you submitted and looking for anomalies and trying to correct things that may be glaringly wrong. Really important that I need everyone to focus on is step 7. That is what we call our data freeze. And I'm going to read the bullet below it. So CSCE freezes all certified data in preparation for public reporting, analysis, and loading into the department's data warehouse, which Kari just took you through. That's EdSite. So once the data is frozen in that big block of ice, there's no going back. So districts need to use steps 1 to 7 to review and make sure that the data that they have submitted to us is 100% accurate. Because in step 8, we're going to our public reporting and analysis phase. So unfortunately, what happens if the data is frozen at that time and something is wrong, a district finds a correction that needs to be done. Let's take a school level, chronic absenteeism rate is not calculated as the district thinks it should be. If it's not corrected in advance of step 7, which is our data freeze, there's no turning back, and that statistic is going to live with the district and school going forward. So it should be corrected in PSIS, but for public reporting purposes, it will not be changed And then step 9, our data is complete. So again, this illustration just takes you through the 9 phases that your data really goes through. So we do our best here to make sure that the data we are putting out is accurate, and we need districts to also be looking at that data, and there are a number of reports in PSIS and the June collection around chronic absenteeism that are really built in to help districts ensure that their data is 100% accurate. So how does the Connecticut State Department of Ed use these data? The chronic absenteeism statistics are used in ad hoc data requests, so when reporters or outside agencies call looking for information, once we're past the frozen data phase, we are at liberty to give that out, and sometimes required to do so. The data can also be found and is used in the Next Generation Accountability Model, which I'm sure most districts are very familiar with. Also, our strategic school profiles. For those districts who are turnaround districts, the data is used there in those reports and trackers. And also, as Kari also just demonstrated, the data is primarily put out to EdSite for public consumption. We're now going to talk about Appendix G, which is one of the appendages of the PSIS User Reference Guide. You'll see it says, "You've got guidance." A quick note on that, and a quick note of thanks to the many districts who weighed in on us revamping our guidance. So nothing has really changed from year to year with our guidance. We wanted to do a better job at clarifying how we anticipate or expect districts to report student attendance to us, specifically looking at membership and attendance days in PSIS. So we're going to go through a few key components of Appendix G, and this document is available on the PSIS public help site. So I'm not sure if there's a link in here, but you can definitely contact myself or Kari, and we can definitely help you navigate to that resource. It's pretty easy. So what is Appendix G? Appendix G is one of the appendices included in the PSIS User Reference Guide. It provides specific guidance on how to report student attendance in PSIS. And again, we just want to thank those districts that weighed in and reviewed the document before it going public to ensure that it was really clear and that there'd be minimal questions and pretty much no gray area now that we've clarified a lot of things. So again, thank you to those districts. So we're going to dive right into it. What is an attendance? So in January 2008, the Connecticut State Board of Education adopted the following definition of student attendance, and we'll read it out. A student is considered to be in attendance if present at his or her assigned school or an activity sponsored by their school, such as a field trip, for at least half of the regular school day. You'll see the part in bold. It's sort of gray, we like to call it. A student who is serving an out-of-school suspension or expulsion should always be considered absent. We have that in bold because that is not always true, and we'll talk about what special circumstance that falls onto in just a few slides. So some general guidance for reporting student attendance in PSIS. It's perfectly acceptable that districts develop their own attendance policies. Many districts have period-by-period attendance, and that's perfectly fine if it differs from what we have in state written guidance. But again, this should be for only your local reporting purposes. It's super important that districts comply with what the state has provided so that we can have reliable data across the state. So, however, for reporting student attendance to CSDE, specifically PSIS, where we look at days of membership and days in attendance, districts must adhere to all guidance provided in Appendix G. And again, you can contact myself or Kari, and we can clearly direct you to that guidance. So really important, any student who is physically attending their assigned school building, and in PSIS, we refer to that as Facility 1, for at least half of the instructional school day should be reported as, quote, in attendance for the purpose of reporting membership and attendance days to CSD. How do we handle early dismissal days? On early dismissal day is an all-day shortened due to inclement weather. The instructional day is calculated as the total amount of instructional time provided to students on that school day. For example, if the school is open for 4 hours due to a shortened or amended school day schedule, a student must be present for a minimum of 2 hours to be reported as in attendance. So you'll notice the green and blue arrows below. My guidance to districts is not to overthink this process and this component. The state board definition requires that a student be in attendance for at least half of the instructional school day. We've gotten questions on inquiring whether that includes lunch or homeroom. We're not looking at that. We need you to look at your start and stop point for your school day and simply cut it in half. So for example, the example on the green bar is school starting at 8 and ending at 3. That's a 7-hour school day. If we took that and divided it in half, we're looking at 3.5 hours. And if the child is in attendance for 3.5 hours on that school day for state reporting purposes, they should be counted as in attendance. And where we shorten the day, we simply take the amount of time for that school day and cut that number in half, and that is our time, our half point mark to determine if the child was present on that day as well. Disciplinary absences. Students serving an out-of-school suspension or expulsion are reported as absent except for each day that the student receives an alternative education program for at least half of the instructional school day. So this is one of the special circumstances that does not quite fit in with the state board definition put forward in 2008. So this just says that students who are expelled or serving an out-of-school suspension can be counted as present on that school day or, quote, in attendance if they're receiving an alternative education program for at least half of that instructional school day. And that is a stipulation. If they are not receiving at least half of an alternative education program for at least half of the regular school day, they should not be considered in attendance and therefore are considered absent. This is a hot topic and we're glad to provide some guidance on this: extended family vacations and travel. Students missing more than half of the instructional school day for the purpose of travel or vacation are reported as absent. The fact that a parent or guardian has authorized such absence has no impact on the child being reported as absent. In addition, students removed from the schools for extended stays abroad are reported as absent even if the child was provided with supplemental work by their home school in an effort to minimize the child's missed classroom instruction. In short, if the child is traveling or away from school, they are considered absent. We've gotten several inquiries around special circumstances. If the child has been sent off to travel and been provided by your local school district with a packet of work, can you count that child as present? And unfortunately not. We like to think of it as a loss of instructional time. So if the child is not in that school building and being instructed accordingly, they are absent. This is really important. Data reporting, please follow the rules. So in the first bullet, if you could follow along with me, districts are strongly prohibited from seeking to use the unenrollment of students to favorably report aggregate school and district level student attendance measures. And districts must adhere to all appropriate due process procedures before seeking to withdraw a student from PSIS, taking into full consideration compulsory education regulations, and that's Act 10-184, set forth truancy requirements and all other necessary documentation required. So, for example, if a child is enrolled in your district and the parent is taking the child out of the country for 2 months during the school year, unfortunately, during that time, the child must be marked as absent. And if you have questions on any specific instances, please feel free to reach out to myself or Kari, and we will gladly help you. Half-day kindergarten programs, we treat this very much like the regular school day. Students who attend a half-day kindergarten program should be reported as in attendance if the student is present for at least half of that program's instructional school day. So again, just taking that school day, slicing it in half, and if the child is there at least half of the day, they can be marked present. Homebound students. Students who are homebound due to illness or injury are reported as absent unless they are receiving instruction and or tutoring from an appropriately certified teacher for a designated amount of time that the school or district deems adequate, which will ensure that the student is able to successfully return to their home school and regular school classroom. We'll notice at the bottom in bold a warning. If an appropriately certified teacher does not provide the student instruction, the student must be marked absent. We've got a lot of questions on what does appropriately certified mean. Appropriately certified means that that teacher would be able to teach that class in the regular school setting. So for example, if a child is homebound, a high school student, the gym teacher may not be certified to teach calculus. And if that is the case, if the district chooses to send the gym teacher, because he's available, or a paraprofessional to issue a packet to the child on calculus, that child cannot be marked present for that time because that teacher is not appropriately certified. Medically fragile students. Students who are absent from school for medical reasons, routine medical appointments, chronic illness, and hospitalizations are to be reported as absent for each day, again, that they are not present for at least half of the school day and not receiving instruction by an appropriately certified teacher. Outplaced students. Their attendance is handled pretty much the same way as students who are regularly attending or placed in a district school. So students attending outplaced facilities like approved private special education facilities or vocational facilities must be reported with all, in accordance with all written guidance provided in Appendix G. What typically happens is that the outplaced facilities will provide the district, the reporting district, with information on the number of days the child was enrolled at their facility and the number of days that they were actually present. So it's the district's responsibility to report that. Letters have gone out from the Bureau of Special Education notifying and reminding outplaced facilities of their requirement to report this information to districts. So it should be on its way soon. And if you're having difficulties with an outplaced facility, please feel free to give myself a call and we will do our very best to assist you in that matter. School-sponsored activities. Students participating in a school-sponsored activity during the instructional school day should be reported as in attendance. Appropriate examples of such school-sponsored activities include, but are not limited to, the following: cooperative work experience programs, community service projects, field trips, and district-sponsored activities. A note on district-sponsored activities: the activity must be sponsored by the district and not simply approved by the district. We're getting a lot of questions from districts regarding college visits. So for example, if a whole grade of students or a whole class of students in the high school are being taken by the guidance department to visit a school, then that is a school-sponsored activity or a district-sponsored activity. That's okay to mark the child as in attendance. However, if the parent is removing the child for a day to visit a school on their own with the parents, unfortunately the child is missing instructional time and that child should be marked absent. And Kari's coming back to tell you what districts can do to improve attendance.
Good afternoon, all. Now we get to the part of our guidance document that gets into where the rubber meets the road, of what districts can do and schools can do to improve attendance. I just want to say that the guidance document is organized it's very simple to navigate. It talks about a lot of what Charlene mentioned about what is chronic absence, why is it important, and then the last two sections of what districts can do and what schools can do. And following up on Mark Quell's presentation, you will find a link to the Appendix G with the resources in the back of the guide, and there are very robust with resources. So getting started, what districts can do to improve attendance. I just wanted to revisit Public Act 15-225, which requires districts and schools to have district or school level chronic absenteeism teams if they reach a certain threshold of chronic absence rate. So it's districts with 10% or higher chronic absence rate is required to have a district attendance team. And just it gets a little more complicated here, but districts with schools with 15% or higher, they should have a school attendance team, and if they have more than one school with 15% or higher, they should also have a district attendance team. So understand the roles and responsibilities at the district level. So what can a district do? Improving and sustaining good attendance requires year-round active engagement of district and school-based leaders and administrators. The first role for the boards of education is to adopt school attendance policies and procedures to support good attendance, and foster continuous improvement and accountability by having your board members review chronic absence data twice each year, and include chronic absence strategies in your district and school improvement plans. For central office administration, their role is key to the success of the whole district in improving chronic absence. So they're responsible for ensuring chronic absence is systemically addressed across the district, to promote and support a district-wide culture of attendance, ensure that evidence-based attendance policies and procedures are in place in all schools and grade levels. And this is important for this to happen at the central office level, is to spearhead the connections with community providers. So if you have a community health provider, you don't have every principal in every school trying to make a partnership or create a relationship with that healthcare provider. The central office staff can pave that road for them. And then elevate the importance of this work by designating a cabinet-level administrator to lead and facilitate the district's attendance efforts. We've really seen this this model have an impact at the district level. If there is a key person at the district in the cabinet level who's addressing chronic absence along with other things, but really keeping a tab on it, we have seen those districts see a big change. And principals are responsible for ensuring that the school adopts and implements a comprehensive tiered approach to improve attendance at all grades. So we'll get into that in a little bit more detail later in the slides. The principal should lead and facilitate the school attendance team, or designate an assistant principal or another administrator to do that on their behalf, and provide professional development opportunities to build capacity for addressing chronic absence. We're seeing a lot of this, and many of our alliance districts are engaging attendance works to have a consultant come in and help them develop strong attendance teams and awareness around chronic absence. So district attendance teams, what happens at the district levels, it brings together the administrators and community agencies to address chronic absence across the entire district. The key functions include routinely unpacking and analyzing data to inform action, organizing systemic district-wide response and policy practice improvement, and to promote shared accountability and continuous improvement. I'm going to go into these in a little bit more detail, but just a district may form a new team for this purpose or add as an explicit function of an existing district-wide group. So unpacking the data. So the district really should, central office and the district attendance team, produce accurate school-specific data reports, best practices every 10 days, so that you can keep track of those students who, before they fall too far behind, that disaggregate the student attendance data by school, grade, and by the subgroups. Use this data to develop your tiered intervention strategies and monitor and understand attendance policies. We've seen in some districts that they're starting to use geo-mapping of chronic absence data by neighborhood or zip code, which may help you uncover certain populations of students who may have barriers such as transportation or safe walking to school that might be something you could resolve pretty quickly or easily for a group of students. Identify schools that need extra help as well as those schools that are bright spots, and use those bright spots as inspirational examples for others. The second function is to organize a systemic district-wide response that includes positive engagement, building capacity, and strategic partnerships. So with positive engagement, we want to encourage district-wide messaging and outreach campaigns for parents, students, and community partners, including your preschool providers. I know many districts are talking about a messaging campaign for August and September for Attendance Awareness Month, and really getting the drum beating about how important attendance is right from the beginning of school. And there's lots of resources for Attendance Awareness Month on the website. So building capacity, ensure that strategies for addressing chronic absence are included in professional learning for administrators and school staff. Strategic partnerships engage the support of the entire community. Analyzing district-wide data provides a platform for forming strategic community partnerships to support that community message, as well as addressing common barriers to attendance. Shared accountability and continuous improvement. So this is how we monitor our progress and set our goals and strategies. Ensure that the educator evaluation and support plan prioritizes reducing chronic absence. Encourage and provide support for student and education support specialists to focus on reducing chronic absence and student learning goals and objectives. Review staff attendance patterns to ensure that adults are modeling the behaviors expected of students. And you can find attendance patterns for your school or your district on our EdSite portal. Set realistic and achievable goals. Now there's language in our guidance document under I think it's under what is chronic absence, that talks about setting achievable target goals. And then lastly, be prepared to tell the story behind the data. If results are different, positive or negative, from the goals established for the time period. Sometimes we realize that we haven't been entering data correctly, and that maybe some students should have been marked absent or not present when they were marked present, and that may impact your data. And if you know that that's the case, be prepared to tell the story. And some years, I know some districts saw a bump in 2013-14, I believe, because there was a lot of snow. So just because your data is not always going in the direction you want, if you have the story behind the data, that you can explain why it is what it is. So beyond what the districts can do, we're going to talk a little bit about what schools can do. And actually, there's a section, this is a section in the guide, what schools can do, and I'm pretty much mirroring that section. So it goes into more detail when you go into the guide and read these two sections about how you really can impact chronic absence. So the first thing is forming a school attendance team. We know that many schools, I suggest that if you have 10% or higher chronic absence, that you consider forming a school attendance team, not waiting for 15% or higher. And I get a lot of calls from school counselors and folks talking about reducing chronic absence, or that one student who they just can't get to come to school. And I ask about their school attendance teams. And many, many times I find that they're going it alone, that there's one person all by themselves, the school social worker, the school counselor, who's trying to bring all these kids back to school, and they tend to be the students who have the highest number of chronic absence rate, and it can be really frustrating. So the research shows, and best practices, that it takes a team, that you really need a school administrator, the school nurse, school psychologist, family engagement liaisons, parents, teachers, support staff. But also, as we've been visiting some of our schools, they're really thinking creatively and outside of the box. For instance, a school secretary really is a lot of times responsible for entering the data. And so having her on, or him on your student attendance team, maybe not every time, but on a certain day when the agenda is going to cover things that might be relevant to their work, that might be important to, don't forget the school secretary. She also, or he also is at the front of the office and may know the parents, then have a relationship with the parents that might help understand why students aren't coming to school, as well as the school resource officer or the lunch lady. The other groups to not forget are your community partners to include on your school attendance team, your youth service bureau, your health centers, school governance councils. I know some school governance councils have really looked at school climate as their project for the year and helped with the chronic absence by making the school more welcoming and warm. The functions of the school attendance teams. To understand and monitor attendance trends, it's all about the attendance. So use qualitative and quantitative data to understand the attendance challenges at your school. Use that trend data to identify subgroups of students who are vulnerable, and then monitor progress. Really get to know who are the students who aren't coming to school and why are they not coming to school, and then identifying the groups, larger groups that you might be able to address the barriers in one fell swoop, or individuals that may be a little bit more difficult and may need a community partner to help with. And then organize the school-wide attendance strategy. So coordinate a multi-tiered strategy to reduce chronic absence, and I'll get into that in a minute. Emphasize prevention, early warning, and intervention. And then identify system solutions and whole school strategies. And then connect families and students to resources. The characteristics of an effective attendance team include there are defined roles and responsibilities. You know who's the facilitator, you know who's the note taker, and the data coordinator. You establish group norms and expectation, utilize a standard agenda. One suggested attendance team agenda includes from attendance work, the first thing on the agenda is the principal will do a presentation of aggregate data. There'll be an early warning action needed report, a review of Tier 1 school-wide interventions, and a review of Tier 2 interventions, and then review of next steps. So have a set meeting time, share and coordinate resources and materials, and define relationship with the other teams such as PBIS, SRBI, or other school-based teams. So understand and monitor attendance trends. The principal should secure regular attendance reports from the central office, and the team should regularly review the data trends every 2 weeks to understand how many and who the students are that are chronically absent. The team is responsible for understanding the causes for absenteeism for individual students as well as common causes for groups of students. Then the team determines which students are chronically absent or at risk of becoming chronically absent and determines strategic next steps. On this slide, I just wanted to acknowledge that there are 4 categories for contributing factors to chronic absence: myths, barriers, aversion, and disengagement. This table came right out of the chronic absence guidance tool, so I don't want to spend too much time on it, but myths are those things are perceptions are absences are only a problem if they're unexcused. It's okay to miss a day here or there. Attendance only matters in the later grades, and pre-K and K are seen as daycare, not learning. So those are myths are going to be part of your messaging strategy, changing people's perceptions and the climate and culture around attendance. And barriers include chronic disease, unmet basic needs like transportation. Aversion is not wanting to come to school because of academic or social struggles, poor school climate or unsafe school. And disengagement means that the student lacks engaging and relevant instruction. There's peer pressure to not be in school, and there's no meaningful relationship with adults in school. We can't stress enough that for those students who are at risk of being chronically absent, connecting them to an intentional relationship with a caring adult can make a huge difference. And lastly, high suspension rates and disproportionate school discipline. How many of those chronic absences are you contributing to by your suspension and discipline policies and practices? So organize a school-wide attendance strategy. Engage students and families. Address attendance barriers and set goals and develop an attendance plan. So students and families are key partners in improving attendance. So it's important to create those caring connections to peers and adults, and a school community that is warm and welcoming. There's resources in the guide around, in this section around doing a welcoming school walkthrough and other school climate and culture resources. Educate and empower families about the importance of attending school every day. They may be new to the country and not understand what the expectations are for education in the United States, so make sure that your communications and messaging are culturally competent for the families. Address attendance barriers, and identify systemic barriers to attendance, strengthen existing policies, practices, and programs to address common barriers across student groups, look at some things that might keep kids from coming to school, like dress code or policies around walkers, who has to walk, who doesn't have to walk, and revisiting are those the students who are chronically absent or tardy on most days. Set goals and develop an attendance plan. So build in shared accountability for reducing chronic absence. Develop a school-wide attendance plan, including assessment of current trend data, target goals, a description of tiered intervention strategies, and how success will be measured. And this should be the work of your school attendance team to really sit down and map out probably at this point in time in the school year what you're going to be doing for next school year, looking at who are the chronically absent students from this year and what are we going to do when they walk in the door next year to make sure they don't continue that behavior and pattern of attendance. Okay. And I also want to remind you that you can enter questions into the chat. We are monitoring the chat, and if you want to have some questions about anything that we're talking about today, please feel free to enter them into our chat. So, the first, I just wanted at this point to talk about a system of tiered supports, which will look familiar to you because we use a multi-tiered system of supports for a lot of our work, but really with chronic absence, Tier 1 is for universal strategies for all students. It's the lowest cost, but it recognizes good and improved attendance, not only perfect attendance, not everyone's perfect, so we really want to see improvement in attendance. We educate and engage students and families, monitor attendance data and set goals. That hold all that school climate work is Tier 1, so we want to make sure we have a nice climate that everybody feels welcome and safe, and identify and address common barriers to getting school. Now, Tier 2 are those students who are missing 10 to 19% of school. These are kids who are moderately chronically absent, and you really, this is where a lot of the work of the student attendance team should be spent so that you can catch those students before they become Tier 3. You provide personalized early outreach to the family and the students. You need to develop a tailored action plan and connect to a caring mentor. And so this is the meat of the work of this student attendance team when they're looking at data. When you get to Tier 3, that's where the high cost, very individualized reasons why the students are coming to school, and it's going to require work from community partners from outside the school. These schools can't do it alone at this point, and they're going to need to work with mental health providers, DCF, or the Juvenile Review Board, or Youth Service Bureau. So just to go. Just to share with you, this is one of the resources that is linked in our guide. It is a pyramid you can fill out for yourself that Attendance Works has developed, and I've seen districts who actually have this in their Google Docs, and every principal can access and see what they're trying to do in each of the tiers. And this was built at a school attendance team level and also at a district attendance team level. So this is here for you just to show some of the resources that are available. So under Tier 1 strategies, we've learned that attendance is higher when schools engage students and parents. So create a school climate that encourages students to come to school every day, offering before and after school programs. We know from research that students who attend before and after school programs tend to have better attendance. Create visuals that reflect attendance messaging. You can use students to create this artwork and this messaging through a competition. I know many of our schools have done this. Call families when students miss school and welcome students back when they return. Also call families when students are doing really well too, so you can build that relationship and it's not just a call when they miss school. Host transition meetings for new families. Recognize good and improved attendance in addition to perfect attendance. So create friendly competitions among classrooms and celebrate individual progress. Recognize students and especially parents at special assemblies. Engage neighborhood businesses in promoting good attendance as well. I was at a school, I think in Bridgeport, and we were talking about how to reach parents to engage them about improving attendance, and we were talking about when do the families come to school. And the families come to school when they have their graduation or transition celebrations for preschool into kindergarten, they come. And so including those messages into those events that parents are coming to is a key strategy. So remove barriers to attendance, conduct a safe walk to school program, which is a walking school bus. And that means that a responsible adult will walk through the neighborhood and pick up kids as they go along and walk to school with the kids, so the kids are safe and they are walking to school and getting to school on time. And organize health interventions such as flu and dental clinics. If you have a school-based health center, that would be ideal for a partnership for them on your student attendance team. Work with health providers to make sure immunizations and physicals are all set so students can start school on time on the first day. I wanted to point out the teacher's role in addressing chronic absence. Teachers are an especially important part and a trusted resource that can make attendance a normal part of their interaction with parents. And they can emphasize attendance from day one, greet students and families personally and ask about absences. Engage students in tracking their own attendance. I know a classroom that is having the students have a calendar, and every time they're absent in their PBIS class, I believe, they have to SRBI class, they have to track those days that they're absent, and talk about attendance at back-to-school nights and parent-teacher conferences, share those calendars that students are tracking at the parent-teacher conferences, and contact parents early and don't wait for parent-teacher conferences. Attendance Works has just released their new teaching attendance toolkit for teachers. It's online, and they will be launching a blended curriculum module to start working to strengthen a teacher's role in chronic absence and addressing chronic absence. So Tier 2 interventions conduct personal outreach to families through home visits and phone calls, train staff on how to communicate with families, recruit students as attendance ambassadors, implement a mentoring program. Success Mentors is a program out of New York City that is research-based and has great success in improving attendance by matching up internal mentors, just staff with several students who are chronically absent. They greet them in the morning, they check in on them, they ask them how they're doing, and if they're not in school, they find out why. And that relationship has made a difference and an impact in New York City on their attendance. And we have a link to that in our resource guide. So then also ensuring priority placement in summer after-school programs. We know that students who are chronically absent, especially our younger students, are not reading at grade level by 3rd grade, so making sure that those are the students who are getting into your summer and after-school programs will help improve their attendance and their academic outcomes. Tier 3 interventions, this is the area where we get the most calls, and it's the most difficult, and we find districts spending so much time in schools on students who have reached Tier 3. Tier 3 interventions are intense, individualized strategies for students who miss the most school. It requires interagency collaboration, coordination, and it's essential to helping students in Tier 3 overcome the serious challenges they face so they can be in school. A lot of times the challenges are not school-based. There's things that are going on in their personal life, at their home, in their neighborhood. So these are students who may be truant or really missed a lot of school. So collaborate with a community-based organization, such as the Youth Service Bureau, to develop and implement community truancy prevention intervention models. Screen students for childhood trauma and providing or connecting to effective evidence-based treatments through kidsmethodmentalhealthinfo.com. Now, these are just a few of our strategies that are in the guidance document. The guidance document has a lot more strategies and suggestions that you may want to consider when you're looking at Tier 1, 2, or 3. So also implement a dropout prevention program such as Check and Connect or Success Mentors to have strong evidence of positive effects on staying in school. And I explained already about Success Mentors and consistently checking with students to facilitate improved engagement in both school and community. So at this point, we have questions and answers. And I'm going to turn it over to Charlene. And just one moment.
So the one question was that.
So we have one question about when the PowerPoint will be posted or the webinar will be made available, the recording of the webinar. And so I just want to say that the PowerPoint will be posted on the chronic absence webpage in the next couple of days, and it will probably the full webinar within a week or so on the chronic absence webpage on the State Department of Education. So I think I'm going to turn it over to Charlie. Any more questions? Just so you can enter them into the chat at this time.
So here's another question. Who would be qualified to administer the screening method in Tier 3? So go back to Tier 3. Can you go back?
Yeah.
And just talk more about Tier 3.
So
there's a question about
there's a question about who would be qualified to screen students for childhood trauma or providing or connecting to effective evidence-based treatments. That would be a licensed clinician, appropriately licensed clinician in your school psychologist or other therapists or your community providers through your Youth Service Bureau or your school-based health clinic would be able to do that. Go ahead, Charlene.
And so this is Charlene as well, and I know that there are selected districts that are having partnerships with other community providers. I think of New Haven, for example, with the Clifford Beers Clinic, and they've had really good relationship with them where students have actually been screened and they're working with a population of students. So, you know, to what Kari said before, I think it is really important to do almost a scan of your community and who are the assets or providers in your community. And I know that on this call today, which is really great, we have some community partners that we would also encourage to reach out to school districts or individual schools as necessary to forge a relationship. So it really is important to look at those community providers and partners that you can find out what's available in your community and make those links. I think what we reinforce around this work is that schools certainly cannot do this alone. And around this issue of attendance, when you go back to what are the root causes of why a group of students or a particular student is not in school, to really get at that root cause, you may realize that to work on the strategies to implement to make a difference, it requires that level of connection with some community partners. So that's really important.
There's a question here about, at the elementary level, there's often concern that if we focus on attendance, we will encourage students to come to school who may be sick. So how do we coordinate attendance regulations and medical issues such as simple cold, runny nose, cough, et cetera? So many schools have handouts that describe to parents in messaging about when it's appropriate to keep a child home or when it's appropriate to send them to school. But also, we also encourage parents in schools to have the parents call the school nurse. And so discuss the illness and the symptoms that the child's presenting with the school nurse and let the nurse help you decide whether or not the student should come to school. If you have a school-based health center, a lot of times there's a practice of if your child's sick, go to the school-based health center before you come into the school. We'll check him or her out, and then they can go on for the day or go home depending on what the school-based health center staff considers appropriate. That's a really good question. So there's a question here that said, I'd love to hear from other schools what they feel has been their best strategy for reducing chronic absenteeism. And we don't really have the functionality here to have a discussion, but we are developing a best practices, promising practices catalog. And so if you find that you're doing something in...
The bright spots within the guide.
Yep, there's some bright spots in our guide about what some districts are doing, so you can review some things that are happening in there. And then we are also doing a catalog of that promising practices with attendance works assistance. So if you are doing something that you think is really working and unique, please contact me and let me know. And let's see if we have any other ones. So this question, do you want to do this one? How do you factor tardiness into attendance rate? Mark, well, do you? Okay. So we don't, at the state level, tardiness is not calculated into a chronic, is not counted into chronic absence. A student's either present or not present. Local school district policies may consider tardiness in their attendance policy, but as far as the State Department of Education is concerned, tardiness is not included in chronic absence rates.
So don't you have a process to go back and make sure you accurately report attendance, right?
Right. So you want to make sure, as Charlene brought up a really good point. So if a student is tardy and it's more than a half a day, that student would be marked absent. So you want to make sure you know when your half-day mark is, so that if a student comes in tardy, you know, and this is where the school secretary who may be entering the data and signing the students in may be helpful, is if a student comes in at 10:30, they're tardy but they're present, but if they come in at 11:30, they may be tardy and absent. So it depends on how much of the school day they spend in school. They have to be there for half a day to be marked as present.
And there's another question here. Is there any data or information to support what can be done over the summer as far as outreach or planning for the following school year? And that's a great question. I believe we've got some tools around that, Kari.
Yes, that's a great question. In fact, we encourage schools and districts to really be working over the summer to address those students who are chronically absent in the year before, especially 8th grade students transitioning into 9th grade. It's key to get to those students and their families. And so there are strategies on Attendance Works for what to do over the summer, and you can contact me for more information about that. But your student attendance team should be making plans for what you're doing in September in your multi-tiered intervention model. Okay.
And you can certainly look to see, I know we've talked about which of your students are the ones that you have concerns about going into the next grade. So you may target some interventions. Kari can speak to it. I know one district that may have, I think, that prioritize those students for a summer program, for funding for participation in their summer program, to help to work with them. Number one, you're getting them ready academically, but also helping to develop that love for school over the summer.
So this is a program for young learners, literacy program that one of our districts, when they only could have a certain number of students for that time, those students who were chronically absent and performing below reading level for their grade were first invited to participate in the summer program. And if they did participate in the summer program, they were then the first to be invited to participate in their after-school programs. And I think I have information on that if you're interested in that. But really, prioritizing who is enrolled in some of these extra supports for students, and looking at the students who are chronically absent who may need that extra support more than others.
There is a question that I'll have Marquel address. I'm not sure we have all the information, but the question is, what if a student has a half-day schedule, like at the high school level, what would you do?
Great. So there are those instances where you may have a high school student who may only be required to take 2 classes, and there's a block schedule implemented at this school, so that child is only required to be in school a half a day. In those instances, we're sort of personalizing the half-day rule for that student, and as long as they're there for, quote, their day, what you're saying is their day, then you can mark them as present. I would suggest marking them as present. But if it's the case where the child is in school half a day and then going to a work program that is sponsored, you want to make sure that all of that is included as the child's work day. The child's school day, I'm sorry.
And if that doesn't fully answer, you can also, you have Marquel's contact information. If you have more context and would like more clarification around that, please feel free to reach out to Marquel as well.
Do you want to do closing remarks? What time is it?
You're very welcome. Thank you. And so we have a few minutes and we're checking to see if there are any more questions. You can also give us comments as well as we're thinking about how we can best support you from the state agency by getting information out to you, pointing out where resources are, in some kind of a regular rhythm of getting information to you without overloading your inbox or planning additional webinar time. So if you really have some thoughts about how best we can continue to provide support to you, we're really open to hearing from you on that. So you can send it to us now, or you know how to reach us afterwards, and we'd love to hear from you on that.
I don't see any more questions.
So not seeing any more questions, just at our closing and wrap up, after today's webinar, we encourage you to do a couple of things if you've not already done so. Form or strengthen your district and school attendance teams. Note that this can be voluntarily done even if you do not meet the statutory requirement for having teams. If you recognize this to be an issue of concern in your district or in your schools, it's just a great idea to be able to get thought partners around the table that include those internally and externally to help to address this issue. Another thing to think about, unpacking and getting familiar with your data, or in other words, know who your students are and the reasons that they're not attending school. Kari demonstrated a really robust ed site. I know maybe our school districts were aware of it, and maybe our community partners were, but there is a wealth of information. You can go on there. If there's a district that you're interested in providing support or working in partnership with, you can have that information. Develop your tiered intervention model. Use the resources that we've provided. And we will certainly spotlight, as Kari mentioned in the guide, that there's some bright spots there so you can see what other districts are doing. And we will soon be putting in front of you a catalog of best practices that are specific to what's happening in Connecticut schools and districts with contact information, so you can also develop that relationship to learn from your colleagues. Identify those community partners who are essential in helping to address chronic absence in your community. That is also very important, and I know I can attest to the partners that we've worked with at the state level and partners that I know are in your local, in your municipality, your district community, that they are really eager and ready to work with you, work together. So this is where I like to call it matchmaking, that you can certainly reach out to the district or the school, and vice versa, the school can reach out, so you can really forge a really strong partnership. We stand eager here at the state agency, really willing, ready to assist you. And I really will close out with a quote from Commissioner Wenzel that I think is really important. And she said, quote, "School districts across the state have been working hard to ensure that all of our students are in school and engaged." She mentioned this at the event that we had to launch the guide, that we're recognizing the result of their hard work. Connecticut is recognized as a national leader for the progress we're making with chronic absence, and that progress is the result of work that is happening in classrooms and schools across the state. And she go on to say, "I'm so proud of our teachers and school leaders who are working with families and communities to ensure students are receiving the education they deserve," and she's inspired by the dedication. And so we are so grateful for all the work that you're doing. We provide the support and the direction at the state level, but we know the work is happening every day on the ground, in classrooms, in your communities, working with families. And so we applaud your efforts. But just a reminder, we still have 50,376 students who need our support, working together to make sure that they're in school every day and connected to learning. Thank you very much for participating with us today. And you have our contact information there as well, and you can reach out to any one of us.